me, and we have agreed that communities are quite diverse. We've talked about the languages, we've talked about the different cultures that they are, we've talked about the different conditions that they are in mental health. But that is the reality anyway, that is how it is. So, if we have to come in to support and to be part of it, we have to take it home the way it is. That's how it looks like. I'm off us, but that's it. And I'm glad, I think we are getting closer to getting the little pinches of what we can do. It's an elephant. Everyone who sees it sees it in a certain direction. But again, we are told that in order to eat or to eat an elephant, you have to take a piece at a time. We've had our colleagues telling us that they bite. Sometimes they bite a little more than they can really take in. But yeah, that happens. And sometimes they say you are glutton when you even stop our children. Don't take in a lot, just take what can fit in your mouth. Yeah, but sometimes that can happen, and I think let's get ready for any of such things when they happen. What I've also realized from this is that the schools are a community, and they seem to be having some low-hanging fruits that we can easily pick and reach out. We've heard about the emotional regulation. Our colleague from Malaysia has told us that, but also literature and studies from elsewhere or benchmarking from elsewhere. We have seen that the social emotional learning for young people is very important. It improves their mental health, and it is something that we have not included in our curriculum here. So are we okay? No wonder we are getting into that direction. Our children are committing suicide, our children are very antisocial, our children are doing so many funny things because we are not helping them emotionally. But for those of you who are listening in, I hope you're picking the lessons. For our colleagues from the US, we want to thank you very much for the support. Dr. Sebastian, thank you very much for insisting on us. Sometimes we can be maybe difficult or even difficult to reach, or we drop down, we get tired very fast. Dr. Sebastian will not. So let's put our hands together for Dr. Sebastian. He reaches out, even at a time he says, no, in the morning I fail to call you, but you see, but meanwhile at that time it's midnight. So I'm like, won't you sleep? He said, no, but I needed to talk to you. He's really that kind of person, very committed and doesn't give up. I wish I can get his energy. Thank you very much. Dr. Coleman, thank you very much. When we came in late yesterday, which we're very sorry, my colleague was like, oh, I've missed Dr. Coleman. I've missed his words. We miss your words when we miss them, but we want to hear more of you. There's a lot, he talks from, I think a very wide point of view, and I think we are learning quite a lot. Even if you knew certain concepts, there's a way he opens them up and widens them and brings it on the table for you to easily pinch and get something. Thank you very much, Dr. Coleman. We appreciate that. We appreciate your time, your ideas, they are here. They are the ones organizing us. Can you imagine? Asking us which date do we come, and yet it should be us, you guys. I think, anyway, we are learning, and I know every year becomes better. The organizers have made it, I think,